Hello and welcome to our second week of our physicians series. And I am so excited to introduce you all to Dr. Elizabeth Olson and Jillynn Fisher. Dr. Elizabeth Olson is a wife and mama of 3 and a healthcare entrepreneur. She is board certified doctor of chiropractic with advanced training in clinical nutrition, pediatrics, and sports medicine. Her daily mission is to help people seek natural and toxin-free alternatives to enhance their overall health and vitality for themselves and for their families. So welcome, Dr. Elizabeth.
Thank you.
And Jillynn Fisher was a respiratory therapist for the past 13 years and recently quit her job as a level 1 trauma center to stay home with her 4 children. She is married and lives on a farm and homeschools her kids and loves educating people on what these products could do for their health and for their lives. Welcome, Jillynn.
Thank you.
And thank you both for taking the time to join us tonight and share some of your knowledge with us about what biohacking is and what the power of nutrigenomics can do for helping us to lead happier, healthier, and less stress-filled lives. So, Dr. Elizabeth, if you could please share with us a bit of your history or your background with us as well.
Sure. This is, what are we on? Our 11th year of practice now. I have been involved with chiropractic for 15 years, which just seems crazy. I am in southeastern Minnesota in a private practice. As Jess was saying, my background is in pediatrics, nutrition, and sports medicine. And I recently have evolved the practice to only be actually doing adjustments a couple days a week, and I'm doing nutrition the rest of the days this week. So, yeah, that's where I'm at with that.
Awesome. And Jillynn, for you too, a bit of your background or history on you?
So I am not a doctor of anything. So thank you for having me on here. But I do love research and medicine. But I was a respiratory therapist for 13 years at a level 1 trauma center. I loved working. I quit my job about a year ago. But I loved working in NICU, did flight team a lot, loved ER, kind of an adrenaline junkie when it comes to that stuff, and really putting a tube down somebody's throat's not the top of anybody's priority list, but it is helpful when they need it. So that's kind of my background in the medical field. I thought there was no way I would ever not be doing that, but with what we're doing now with LifeVantage, this is so much better. It's so much better. So yeah, thanks for having me.
Awesome. So, Dr. Elizabeth, would you explain to us what biohacking is?
Sure. I love this. Biohacking to me is using really specific strategies to change your genetic potential, to change your biology overall. So we're using very different protocols to produce different and activate different things within our bodies.
Great. So there are people that are on this call or maybe listening to this after the time that are currently taking supplements. Can you explain to us the difference between supplementation and activation, Jillynn?
Yeah, so I love this question because I was a big quote-unquote supplementer before finding LifeVantage. And really the biggest difference is supplementing is giving your body a bunch of extra, and kind of, in my mind, was hoping that I would hit what I needed. Whereas activating is giving my body what it needs to function at its greatest potential, and turning on what's already there. Those things that, kind of start to dim as we age, just giving it exactly what it needs to turn back on and do great things to keep us healthy, and, have that kind of vitality that we want as we age.
Awesome. Dr. Elizabeth, could you explain what oxidative stress is and what it might be linked to or connected to, where we've seen signs of oxidative stress.
Yes. So I think at its core, you can think of oxidative stress as cellular inflammation and the aging and damage that occurs with that. And as it branches out and affects other systems of your body, there's so many different things. Excuse me, my voice is going out here. So many different things that we're noticing, and it's linked, basically a precursor, a starting point to thousands of health-related issues, diseases, symptomatology, and different things like that. So it's like the beginning point of anything that produces a negative health ramification for you.
Great. And Jillynn, do you know if oxidative stress can affect animals or children? Are there researched, is there researched evidence showing oxidative stress affecting different mammals?
Yeah. So I was going to say we're all mammals. The interesting thing with specifically pets and dogs is there are studies out there that I know specifically it tried to be a placebo-controlled study with NRF2 activation. And the interesting thing with pets is that they produce oxidative stress at a much faster and higher rate than we as humans do. So they produce it 7 times faster, but they also decrease it 7 times faster. There's a lot that points to the fact that, kids with things like autism and ADHD, those produce a lot of stress in the body, free radical damage that increases to obviously increase oxidative stress. So yes, there are, it doesn't just affect adults as we get older. It's in all mammals.
And Dr. Elizabeth, if you were going to look at some of these studies, some of this research, where would you go to find that research, and how would you know that it was reliable?
Okay, so the best source is always pubmed.gov, which any person can go to. It's basically an accumulation of research articles. There's more advanced searches that are available, but you basically can type in oxidative stress and it'll produce all the studies linked to oxidative stress. Or you could go more specifically into it and put oxidative stress and NRF2 activation and see what more specific studies are available for you. And that really guides you into a reliable source of peer-reviewed research.
Excellent. And Jillynn, why do you think it is that that for the most part, people are not educated about oxidative stress? And it seems as though even medical professionals are not aware of it. Why do you think that is?
I think actually medical professionals are aware what oxidative stress is, specifically not knowing so much about what NRF2 activation is. But they know what oxidative stress is, but up until very recently, there was nothing they knew of to do anything about it. There was nothing that could significantly reduce it. They knew the link that it had to disease processes that they're dealing with. And just, me specifically with things like, kids with cystic fibrosis and stuff like that. There's so many different aspects of oxidative stress that they know about. They just didn't know a significant way to reduce it. Does that make sense?
Yes. And so, doctor, could you please explain to us or help us understand why it's important for us to take control of our oxidative stress load and how we could do that? What is this NRF2 activation that you two have been leading up to?
Yes. So as we were kind of talking about before, oxidative stress, it snowballs. It hits every system within our body. As it grows, it continues to grow at faster rates. And it is the precursor to all these different types of negative health-related issues. And so if we don't rid ourselves of it, we will eventually end up with some type of negative issue. And so what we can do is we can activate our NRF2 pathway. And what that specifically does is it causes our body to overproduce, well, not overproduce, just produce large amounts of antioxidants for us. And antioxidants are really important, especially when we produce them in our body instead of consuming them directly, because they help wipe out the molecules that create oxidative stress. They help neutralize them. And so when we activate our NRF2 pathway inside of our bodies, we're able to wipe out oxidative stress in high numbers in short periods of time. And that's why it's so significant to activate this type of pathway versus supplement with a direct antioxidant.
And what is this product that you're using, and what kind of a reduction in oxidative stress are you seeing?
Okay, so the product is from a company called LifeVantage, and it is Protandim NRF2. And what it is shown to do is actually reduce oxidative stress levels by 40% in 30 days, which is almost half of your overall cellular inflammation. And it accumulates in your cells over time. It actually is more effective. Somewhere around the 90-day mark, studies show it, we have reductions in about 70% of our oxidative stress levels, which is mind-blowing. And it produces such amazing health results for us because our cells are just cleaned up. These processes are just cleaned up, and they're able to have full health within the cell.
Jillynn, could you tell me, as far as this specific product goes, this Protandim NRF2, could you tell me, is there any research or validation? How long has this product been around? Are there patents? You know, any kind of background on that, on this specific product?
That's actually the biggest thing that caught my attention. My personal story was very skeptical, but I started seeing results and then dove into the research. And that's what caught my attention with, we have 7 U.S. international patents on this the branded supplement that is called Protandim. The biggest thing that I found every time I would go to PubMed.gov and type in a supplement is that nothing was there. And my biggest hang up was, if something says it's going to do something, I need proof. I need blood that's going to back that up. And so that's what we have. We have 27 peer-reviewed studies on PubMed on the branded proprietary blend of this supplement. That was hard to find anywhere else for me. In that, you know, people say a product is highly researched. You go research it, and it's like, crap, an ingredient in your product is highly researched. I agree there, but what is actually synergistically combined in this product is not. And we do have that, which was mind-blowing and a very good validation.
Awesome. And Dr. Elizabeth, could you tell us if there are any interactions with Protandim and other medications or other supplements or anything else that someone could be taking?
There is no research proving there are any type of interactions within our product. If anything, because of the activation, our cells probably receive and connect with these products better than they would without these products, which is something very interesting to think about. There are also studies comparing Protandim NRF2 to other pharmaceutical products for different treatment parameters, and showing that Protandim is more effective than any of the typical treatments, pharmaceutical treatments that could be done in certain types of health-related issues. So again, check these studies out on PubMed. As Jillynn was saying, it changes the game because there is nothing else out there that has this kind of backing behind it.
Could you, to follow that up, could you just in general terms explain your favorite study on Protandim? You know, what's the one that really caught your attention?
That really caught my attention. I think the first study was the MS study comparing Tecfidera to, which is a typical treatment protocol for multiple sclerosis, and comparing that pharmaceutical to a control group that took Protandim NRF2. And the results of the studies were, the result of the study was that basically, interestingly, it was a more effective treatment parameter than the Tecfidera was. They stated that directly in their study. But there's so many that I love. I love the ones that show the basic nerve cell regeneration and growth. I love explaining to other healthcare providers about the chemopreventative aspects of these activations. So it's hard for me to just pick out a couple, really, because they're all very interesting to me, and I love to educate people about each one of the studies. So those would be my probably top pickers.
Excellent. And so just on a similar note to that, could you explain to us what mitochondrial dysfunction is, Dr. Elizabeth?
Sure. So our mitochondria are kind of the gateway for our cell. They're also what produces all of our most of our cellular energy in the form of ATP. And what happens over time, of course, is that we're exposed to different stresses, environmental stresses, and different toxins and things, and these mitochondria become damaged. When they become damaged, we're unable to actually produce that energy for our cell that we need, and then our cell isn't able to function or be healthy. And I guess probably the ramification we originally see is just physical fatigue, and that ramps up as more and more mitochondria are damaged. We just don't have the energy to put out for healing and for helping our bodies have true health.
And so what are ways that we can influence our mitochondrial function? How can we improve the function of our mitochondria?
Well, in the past, I would have always said cold laser is the most dramatic way to improve our mitochondrial function. But what we now have is a pathway activator, Protandim NRF1 synergizer, that causes our body to begin expressing new genes that actually they control the healing, basically, the damaged mitochondria, and then produce beautiful brand new replications of these mitochondria. So then our mitochondria are then, not only do we have a higher number of them, but they're networking better. So we just have this big effect of energy production in the cell, which is amazing, because then our cell is able to have its highest health potential. And that gateway is opened back up, which is really important. If you see some of the new research coming out on NRF1 activation, there are huge chemopreventative effects, again, with this mitochondrial function, because they are also the kind of a gateway into the cell.
Jillynn, in your team so far, and people that you've seen using NRF2 and NRF1 products together, what kinds of things do you see improvements in? I know we're not treating any symptoms, conditions, or diseases, but once we get these cells activated, what are you seeing? Just generally, some things that you've noticed.
I think the biggest thing is increase in energy and better ability to sleep. Just for the generalization. Now, obviously, like you said, when you research specific disease processes and oxidative stress on PubMed, you can find for yourself the correlation between those things. And so the evidence of that is in, different people's bodies and what they have going on. For me specifically, with migraines, I got to the root cause of what was causing significant 4 to 5 migraines a week, and have now not had a migraine in 2 years. I got to the root cause of that in my body, which was high levels of oxidative stress. And so for each person, obviously, it looks a little bit different. I'd say the biggest things are increased energy, increased ability. For my family, just recently, they were in a horrible car accident. Just ability to heal, and not, that body's ability to keep that inflammation where it needs to be for proper healing, but not to the point where it's harming their bodies as they heal. So, things like IBS, I've seen people's lives changed, literally changed, the functionality of their life. Like Dr. Elizabeth was saying with MS, I have seen that in patients and people that have started taking these products, just their body's ability to function without the side effects of a pharmaceutical drug that can be significantly damaging.
Yes. And Dr. Elizabeth, what other supplements would you recommend for a foundational nutrigenomic regimen?
Yes. So I would begin thinking about our gut health and add in ProBio, our fabulous probiotic. This helps us not only metabolize our food better, there's a huge component of our immune system within our digestive tract, our gut, and there's that really intimate connection with our brain. So it supports that gut-brain connection. The second thing I would add in, as I've always said, every single person should be on a fish oil from in utero until death. Just making sure that's an extremely high quality, pure form of fish oil. And I love LifeVantage's Omega Plus because it has some additional benefits that are added in with it. So those, that along with Protandim NRF2 and Protandim NRF1 would be the baseline I would start with.
And Jillynn, could you explain what other kinds of products that LifeVantage offers? What kind of the categories of products are there?
Yeah, so I love how they've taken the technology and research that we have in Protandim NRF2 and our, the research that is very big in NRF1, but energy drinks, I was not, honestly, I'm completely open book here, but I was not happy when I saw that they had one. But then in researching it, I was like, this is legit. I've been giving that to my daughter since she was 8 weeks old. It's good, B vitamins, nice, and those things that are good for the brain. We have skincare that Louisiana State University actually came back to our company and asked us to produce an NRF2 activating skincare line, and it is phenomenal. We have Pet Tandem because people are given Protandim to their horses and dogs and cows and pigs and all kinds of animals. So the company has that as well. And then we have our Physique line that really focuses on gut health, which I am super passionate about. With 70% of our immune system being in our gut, we have Wellmune in our probiotic, which is part of that Physique line that we have. And so if your gut's not healthy, you're not healthy. And the company understands the validity to the fact that if your gut isn't healthy, your body will not release fat storages. And then the newest line that the company has that I am like in love with is our hair care, which I never thought I would just love a hair care line so much, but I love it. So we've kind of hit all of those key areas of, vital health, I think. So
to close up, I'm just going to kind of ask you both kind of a similar question to answer. As someone who's very passionate, obviously, you both are, about what we're doing before and what you're doing now. And you have a lot going on with multiple babies and houses and husbands and whatnot. So if you could just answer a question for us, why you have chosen to become a distributor for LifeVantage and what it's doing in your life.
You want me to go first? I will. It's kind of evolved for me, I have to say. At first, it was just to get myself and my family on the products, to start experimenting on myself. And then it was implementing it gently into my patient base. And now it's evolved to me wanting to be working with this company and working with these products more than I'm working with patients, more than I'm in the clinic, because I can see the potential. I've done a lot of research and learned a lot more about the business model and the compensation plan. And I'm looking and have been looking for a lot of years to create another source of income that has more stability and leverage for my family and for myself. So we can take some of the pressure off of my husband and I having to constantly hustle and run that hamster wheel, as well as just making more time, quality time with my family. So for me, that's how it has changed and evolved.
Mm-hmm.
I said I would never do this business ever. And obviously that's clearly changed. And so I've been a distributor with LifeVantage for just about a year now. And it has changed our family's life, starting with the products. And really, I honestly was sharing this with people. I had referred, my entire family was taking the product before I became a distributor because I was passionate about that. And then, it was kind of my husband was laid off from his job last year, along with 6,000 other people. An entire division of the company he worked for was just eliminated that day. And we were having a baby in 4 weeks, and I still was saying I would never do this business. But God had other plans because I'm a really stubborn person. He has to do things the hard way with me. But it has quickly turned into the fact that I know I can bless so many people's lives and help so many people, more so in this business model than in any other. In the hospital setting, you trade time for money, and really I can reach a bigger group of people with the way that this is set up, where I get to help people that I would never have access to or any relationship with outside of the team that we build in this company. And so that's it was on accident that I became a distributor with LifeVantage. It was kind of a testing, I guess, of can this work for me? Can this work for my family? And this has quickly become our plan A, where getting my husband out of corporate America and having that time freedom that Dr. Elizabeth was talking about is super important. We did a lot of traveling with the company this year, and he is out of vacation, and I'm over it. I'm just over it. So, how we became a distributor was backwards, I think, but the blessings of it are huge, both for the people that I get to share this with and for my family financially. And it took me a while to grab onto the fact that I could have both. So
it sounds like you both have definitely the passion to help people with their health, and that with the stellar products and a good business model, it's a great combo. So I thank you again for your time, and everyone have a good night.